Hi, everybody. I'm Dr. Ellie Stein. I want to share with you a really important paper that was just released on patient-reported treatment outcomes in ME, CFS, and Long COVID. The study was called TREATME. It was funded by the Open Medicine Foundation. The first author was Dr. Martha Ecke, and colleagues included Dr. Ron Davis, Dr. Jonas Bergquist, and the lead author was Dr. Wenjuan Xiao. The study reports on 3,925 real reports by real patients using a very detailed, more than 120-page questionnaire. The weakness of the study is that the reports are without confirmation. So we're basically trusting people to accurately report what treatments they tried and how well they worked or didn't work. Now, this study is really important because there are millions of people around the world with ME and Long COVID, and there are no evidence-based cures. That means that patient-collected data is a really valuable source of information that will help us build hypotheses about which treatments deserve further research. As mentioned, there were 3,900 plus subjects, and of these, 2,100 had ME/CFS and about 1,800 with Long COVID. 76% of the Long COVID patients and 82% of the ME/CFS patients were female. So this gender split is pretty typical. It's usually somewhere between 3 and 5 to 1. The average age is also very typical for ME research, which is 47.5 years for the ME/CFS group and slightly younger at 44.1 years old for the Long COVID group. Of course, the area where the two groups really differ is in how long they've been ill. So the average ME patient in this study had been ill for 12.7 years, whereas the average Long COVID patient had been ill for 1.6 years. So that gives you a little bit of context. And now I'm going to talk about what are the symptoms that the patients reported. Now, there's really no surprises here. The top 5 symptoms mentioned in this study are the same symptoms that are mentioned in the IOM 2015 diagnostic criteria report. So top symptom, no big surprise, fatigue, occurring in more than 95% of people with ME and 88% of people with Long COVID. This was closely followed by post-exertional malaise, brain fog, unrefreshing sleep, memory problems, and POTS. POTS came in at about 40% in both groups. They also asked about comorbidities, and in both samples, the most common comorbidity was mental health, a combination of anxiety and or depression. This was reported by 56% of the ME/CFS group and 51% of the Long COVID group. Honorable mention goes to migraines, which were present in almost 50% of the ME group and 41% of the Long COVID group. Now I'm going to slowly walk you through figure 2 from the paper, which I think is the most important figure because it really summarizes what people reported. Over 150 treatments were mentioned by varying numbers of people. If you look at the left-hand side of the screen, you'll see words like fluid and electrolytes, so that's the treatment being commented on, and then you'll see a number, in this case 3,053. That means that a lot of people tried fluid and electrolytes. They were asked how much better or worse that treatment made them, and each of the answers was given a color. So the orange and yellow reflects people who said the treatment was beneficial, whereas the blue reflects the number of people who said it caused side effects or harm. In the middle is gray. Those are the people who said it didn't make them better or worse. The middle formula here is a way of comparing the treatment in question. Say, again, we use fluid and electrolytes as an example, and they needed some kind of control to control for the fact that you're trying something, and that might make you feel better or worse, even if it's a placebo and not really an active treatment. So they made a decision, which I thought was quite smart and interesting, to use vitamin C as the control. So all of the treatments in the graph, like all 150, were compared to vitamin C. This is regular by-mouth vitamin C, not in a liposomal formulation. And if this number, it says, for example, 1.0 E minus 171, that's a really, really significant difference. So the larger this number, the more beneficial the treatment is compared to the control vitamin C. And the treatments are ranked in this chart based on that number. So if you look at this number, it slowly gets smaller as you go down. This is a list of the top 20 treatments out of the 150 that were mentioned. Now, this third column comes from this formula up here. You have the number of people that reported a treatment was beneficial, the orange, yellow, and very light yellow. You subtract from that the number who tried it but found it harmful or causing side effects. You divide that number by the total number who tried the treatment. So obviously, a higher number means the treatment was better. And this was called the net assessment score. So if you look at these numbers down the right-hand side of the left-hand column, you'll see that in general, the higher numbers are at the top, but they're not in perfect order. So for example, the highest net assessment score in the entire study is for pacing, slightly outranking fluid and electrolytes, and then it goes down from there. What's really interesting, but again, not surprising, is that of all of the therapies tried, the one that gets the absolute lowest score with a massive blue bar is graded exercise therapy. So it got a minus 72%, meaning it made most people worse. Finally, there's something at the right here in green called a heat map. They measured the effects of each of these top 20 treatments for each of the top 5 symptoms. So they wanted to figure out, do the treatments help everything, or do they have specific target symptoms? And these are the top 5 symptoms that were reported: fatigue, PEM, POTS, brain fog, and unrefreshing sleep. The darker the green, the more beneficial the treatment. And you'll see that only 2 treatments have a positive effect on all 5 symptoms. By far, the strongest is pacing, and the darker green means it was more beneficial for that particular symptom, in this case, fatigue or low energy. And if we go down towards the bottom, you'll see that vagus nerve stimulation is the other treatment that was generally beneficial, though the color of green is slightly lighter, meaning it wasn't as beneficial as pacing. A couple observations about the things that made it into the top 20. I was really interested to see that the top 3 treatments are old-fashioned, tried and true, things that people can do at home at no cost, and they include fluid and electrolytes, pacing, and compression stockings. As we move down the list, you'll see a number of treatments that are more specific, and I'm going to show you a chart about that in a minute. But just as an example, antihistamines only act on 2 of these top 5 symptoms. Vitamin B12, again, only acts on 3 of the symptoms, but fatigue and brain fog are among them. And then if we go to some specific treatments that are for autonomic dysfunction like beta blockers or ivabradine, you'll see that it's very specific for POTS and doesn't have much of an effect on the other symptoms of ME or long COVID. Here I'm showing you a chart which I created from the data in the study. And it's to show that many of the treatments were not generic or generally helpful, but rather they really helped with specific symptoms. And this suggests that when you're seeking care, or if you're a healthcare professional and you're providing care for someone with ME or long COVID, you need to do a really thorough history to identify the specific symptoms that that individual has so that you can target the treatments. So as an example, antihistamines were not that helpful in general, as you saw from the first chart, but they really helped symptoms of MCAS. Low-dose naltrexone was most helpful with fatigue, brain fog, and pain. Immune globulin was most helpful for immune dysfunction symptoms. Now, this wasn't really defined what people meant by that, but presumably it would be people who were either getting sick all the time or who had a lot of ongoing immune symptoms like fever, sore throat, swollen lymph nodes, etc. Stimulants, things like dextroamphetamine or methylphenidate, were most helpful for brain fog and general fatigue. The authors made a note, however, that at least 5% of people reported adverse effects from these drugs. So what that means is some people can have both beneficial and adverse effects from the same drug. Ivabradine and beta blockers were most helpful for POTS, postural orthostatic tachycardia syndrome. So that's a situation where the heart rate is too high when you're in an upright position. It was noted that ivabradine was more effective than beta blockers. Melatonin was the only drug that was consistently helpful for unrefreshing sleep, even though other drugs frequently used off-label for sleep, things like trazodone, were also mentioned. Vitamin B12 helped for fatigue, brain fog, and PEM, and the injected form was noted to be better than the oral form. CoQ10 was helpful for fatigue, brain fog, and PEM, as one would expect if it's able to enhance mitochondrial function. What was interesting, and it really kind of correlates or confirms what I noticed in my own practice, is that you've got to take a hefty dose. You have to take at least 200 milligrams a day. Anticoagulant and antiplatelet drugs like including lumbrikinase and nattokinase benefited multiple symptoms, but more than 5% of the participants mentioned that they had to discontinue it because of signs of bruising or bleeding. If you decide to read the paper, which I recommend, it's not that tough. I think the average informed patient could make their way through the paper. You want to look for what are the symptoms that you have and what does the paper have to say about the most effective treatments for those particular symptoms. Now to wrap up. Note that for most of the treatments of the 150 reported, some people got better and some people got worse. So this means that there's a lot of diversity amongst people with ME/CFS and long COVID. Many of the 150 treatments in that figure 2 that I showed you, those were the top 20. So there were a whole bunch more that did not show overall improvement compared to the reference or control substance, the non-liposomal vitamin C. And it was noted that many neuropsychiatric drugs like antidepressants fell into this category. Now, some of these drugs were reported to be helpful and even had a positive response rate of above 50%. Some examples included trazodone, gabapentin, low-dose Abilify, and mitodrine. However, many of the psychiatric drugs also had high rates of negative effects. And so what that means is when you take the positive and you subtract the negative, Many of them fell out of the top rankings. Some that had more than 20% of people reporting negative effects include most of the antidepressants, gabapentinoids, meaning gabapentin and pregabalin, modafinil, a drug that's a non-stimulant, arousing drug, something to help keep you awake, low-dose Abilify, and things like Florinef, which helps keep blood volume up, Midodrine, which helps keep blood pressure and circulation up, and cognitive behavior therapy. A few other observations. Many of the treatments in the top 20 are difficult to obtain and are expensive. So what this suggests to me is that the people responding to the study overall were well-resourced, meaning they had access both to money and to skilled practitioners to be able to try some of the more experimental treatments like immune globulin, Maraviroc, and vagal nerve stimulation. Although they report these as being helpful, it's hard to know, would these treatments help patients who don't have a skilled healthcare practitioner kind of guiding them, and maybe who couldn't make as accurate decisions about which types of treatments might benefit them. There was a statement in the paper that illness severity, which they called capacity, was the most important predictor of treatment benefit. But there was no description of what that meant. So does it mean, for example, that people who are more severely ill, having lower capacity, were more or less likely to respond to treatments? Or was it individual, that maybe they're more likely to respond to some and less likely to respond to others? I was really surprised that fluid loading was very popular. Well, I wasn't so surprised with that. That's a commonly recommended treatment. But pacing, which to me is something that virtually every patient with ME or long COVID should try, was much less endorsed. Far fewer people tried pacing. Those that did found it extremely helpful. The symptom profiles for ME and long COVID in this study were extremely similar. So this adds even more weight to the already strong belief that many people with long COVID develop a syndrome of symptoms very indistinguishable from ME, and also supporting this hypothesis, the treatment responses, like what treatments were helpful and what symptoms did they help with, were also extremely similar in the ME and the long COVID groups. The results, therefore, suggest that there's a lot of diversity or heterogeneity, and that there's unlikely to be a one-size-fits-all treatment, even with new treatments hopefully coming online in the near future based on some of the really exciting research that's going on. In my opinion, having worked in the field for 25 years, it's likely that some of these new treatments are going to be extremely beneficial for specific subgroups, and those subgroups will be identified either by new emerging tests using the multi-omics approach, for example, or based on symptom profiles. What this means is that personalized medicine is necessary. The practitioner has to ask an in-depth history to really get a profile of an individual patient and figure out what symptoms they have, which are really holding them back from functioning better, and which treatments are going to be the best fit for that individual. A final comment, the patient advisors to this study told the researchers that in the absence of significantly curative treatments, even strategies that lead to a small improvement, and I believe they were talking in the 10% range when they mentioned this, were valuable. There's a lot of nihilism, right? Thinking, oh, if it doesn't make a big difference, if it doesn't cure me or transform my life, it's not worth trying. But for those of us who have been in the trenches for decades, the opposite is true. Health is like a puzzle, and the more pieces you can put in place, the better. And in my opinion, the more pieces you get in place treating your individual symptoms, the better the chances that your innate healing response is going to kick in and take you the rest of the way. I'm really interested in your thoughts and questions about this study. Maybe you notice things that I haven't even mentioned. I haven't reviewed the entire study for example, there are other sections to it, but I reviewed what I thought was perhaps the most interesting to the most people. But maybe there's other findings that you want to ask about or comment on. Maybe there were shortcomings of the study that went over my head that you want to point out. So I really look forward to a respectful and fulsome conversation about this study. In the absence of a cure, knowing what 3,925 patients have found helpful is extremely valuable. And I'm very grateful to the research team that has done the hard work and published the data for all of our benefit.